Hey there guys, this is Alex from Mental Health Thinking, and I have Gino Medoro here. He's the clinical educator for Queensland Health in the Sunshine Coast area, and I've had a bit of a chat to him about one of the techniques that he uses as a psychologist called Imagery rescripting. So thanks a lot for being here, Gino, and thanks for taking the time out of your day. We're actually at the Sunshine Coast University Hospital, which is quite a large one in the area that's come to us quite recently, isn't it?
Absolutely, yeah. It's only recently opened around April, so it's it's all brand new. It's great.
Yeah, certainly. Looking around, everything's very pristine. So getting on to imagery rescripting, just as a technique, if we start from the premise that there are different techniques that you can use as a psychologist in therapy, how would you describe imagery rescripting?
I suppose one way of describing it, it's an experiential technique. There's cognitive techniques which look at people's thinking, how they understand a problem, and then there's experiential techniques regarding how a person actually feels about a problem. And sometimes, even though rationally we may appreciate that something doesn't make sense or isn't a helpful approach for us in life, but we still respond in a certain way emotionally. And with the imagery rescripting, it's a great technique to be able to look at that emotional change. Where we tend to go through life viewing life through our own filters, and those filters can be described as core beliefs around how we see ourselves, the world, and other people. And imagery rescripting can work great in being able to change unhelpful core beliefs to more helpful core beliefs. And imagery rescripting specifically focuses on those unhelpful memories, maybe when we were young, children, adolescents, which impact on those core beliefs, which then impact on the way we see ourselves in the world.
Okay, so just a couple of follow-up questions on what you've said. You said that this is an experiential technique versus some cognitive techniques.
Yes.
What are some other examples of experiential techniques?
There's mindfulness, hypnosis, and other experiential techniques. And there's, I suppose, with psychoanalytic approaches or around tapping into the subconscious. So it's they tend to be the main experiential techniques, but there's actually a broad gamut, and there's heaps of variations.
Okay, and just for the audience, you mentioned core beliefs. So could you give just a brief description of a core belief?
Okay, so core beliefs, it's a categorical statement regarding ourselves, other people in the world. From my clinical work, there tends to be three core beliefs that have a major impact. We need to feel safe. So if we feel that we're relatively safe in the world, then it means that we can tend to be maybe more adventurous. And the flip side of that is feelings of vulnerability. And that can occur in people with childhood experiences of maybe lots of change, lots of unpredictable change, maybe a violent alcoholic parent, never knowing quite sure what the day is going to pan out like, creates a sense that the world is a dangerous place. That's vulnerability. The other one is self-esteem, feeling that I'm a good enough person. And the flip side of that is I'm not good enough. And that could be a consequence of childhood experiences of a critical parent, a critical teacher, being bullied at school, where develops the belief that I'm not good enough. And another third key one is affiliation, that I'm a worthwhile, lovable person. And the flip side of that is I'm unlovable. And that tends to be a consequence of childhood experiences of when people feel rejected or unloved or neglected. And so they seem to be the core ones that I've come across in my clinical work. And parallel to that is schemas from schema therapy. And I've lost track, but I think it's around 16 schemas. And so, as you can imagine, it's more fine-grained regarding how people see themselves and other people, and many of them are a variation of those three core beliefs.
Okay, so could you just briefly give us more of a description about the technique itself?
Yep, sure. There's a number of stages to that, and usually the first stage is the client will come in with a presenting problem, and invariably there's some sort of situation or event where it results in an emotional reaction, whether it's fear or anxiety or low mood or distress, and I would unpack that. So tell me about the event. A key question is, what was the worst thing about that event? And the idea of that type of questioning is to get to the core belief that the worst thing about it was I felt totally vulnerable, or I felt rejected, or I felt that wasn't good enough. And then following up from that, I would then ask, does that have any associations for you when you were younger? And the idea of that question is to identify those key childhood events that impacted on that core belief. And that's very efficient questioning, because sometimes it can actually be a quite innocuous event that for whatever reason impacted on the child, which then led to those core beliefs into adulthood. From experience, the ages between, if they come up with a memory between ages between 5 and 10, that sort of rings true for me as a relevant memory. If it's sort of later in adolescence, I always ask if there's an earlier memory, and if there's multiple memories, then I tend to notice that tends to have a direct relationship with the level of their difficulty. So if there's multiple memories of being rejected or feeling unloved or feeling frightened, then their difficulty tends to be that much more intense. So if they're able to identify a key memory, I usually ask questions regarding how vivid is the memory for them, how it makes them feel when they talk about that memory, and that gives, so in a way it picks up whether it's like a trauma memory. And the more vivid it is, if they can say, well, actually, Gino, I can picture it, even though it's 20 years ago, I can picture it like it's yesterday, just thinking about it makes me sick. That gives me the clues that that's actually the key memory. Then there's the, I get them to explain it, to unpack it, and then if I get a sense that that's the memory that needs to be worked on, then we go into the imagery rescripting itself. So the first stage, I ask the person to usually just relax, close their eyes, just focus on the present, and then I ask them to go back to that key memory, put themselves into the mind, the shoes of their child self. So viewing the situation as that 6-year-old girl or that 10-year-old boy. And then I ask them to actually walk through the scenario from the beginning of the memory to the end of the memory. And in some ways that process is exactly what occurs in traditional reliving for trauma work. And the idea is to go through it in detail, repeat it on multiple occasions, and then that reduces the traumatic response. Research suggests that works brilliantly, but only for fear-based trauma. If there's shame or guilt or self-esteem issues, then reliving itself doesn't tend to be the best intervention. So once they've done stage 1, stage 2, I ask them to take themselves out of the mind, the body of their younger self, and put themselves back into the mind, the body of their adult self. But this time, to put themselves back in that scenario, in that memory, but almost as an observer, almost like a fly on the wall. And in this case, observing the exact same scenario from start to finish, but through the perspective of their adult self. And that could be a really valuable process because it creates perspective. In a way, they're able to see their younger self, and especially if they develop core beliefs that they're defective or they're terrible or nasty, seeing their small, vulnerable younger self can very quickly change perspective, going, but why is that parent, teacher, person speaking so nastily to this poor, vulnerable child? So they also have perspective going, dad came home and he doesn't like his job and is taking that on the kids. So that stage is really good at developing perspective.
Yeah.
Which in a trauma memory, as a child, there doesn't tend to be perspective at all. As a 7-year-old, if a parent says, "You're stupid, you're useless," unfortunately the child takes that on face value. A 7-year-old doesn't understand wider context.
And in that second stage, you often use the idea of them being a fly on the wall or something like that as well, don't you?
Yeah, because it's a slightly unusual concept to get your mind around. The whole idea is, well, I'm observing myself. So I use that metaphor of sort of the fly on the wall as a way of helping the client to have that perspective.
Yeah, I recently did it with a client who said, "Oh, can I be a butterfly?" And I said, "Sure."
Why not? Why not? And then stage 3, which is actually the empowering stage, is we get that adult self, that fly on the wall, to then enter the scene and then do whatever needs to be done to make that situation right. So in often cases, it's confronting the abuser, usually saying things like, "How dare you speak to my younger self like that? They're a harmless child. They haven't done anything so terrible and nasty that deserves that criticism. You should be ashamed of yourself." If the abuser appears frightening and scary in this stage, the abuser can be shrunk. They could be given sort of a squeaky voice or clown ears, anything that actually helps to diffuse the fear and the power of the abuser. Sometimes that they may want to have additional help, so they could bring in an image of police to take them away, or they could bring in friends or family, even the therapist sometimes, to come into the scenario to help confront the abuser. I tend to prefer the individual to do it themselves in the image, because as you can imagine, that's quite empowering. But if they need additional help, then that's fine as well. The next stage is invariably I ask, "Is there anything you'd like to say or do to your younger self?" And invariably the conversation involves something like, "Don't worry, you don't deserve to be treated like that. You haven't done anything wrong. You're a worthwhile child." And invariably there's a hug involved. And as you can imagine, it's that type of conversation helps to build self-esteem and affiliation, and also creates a sense of safety if there's the scary abuser.
Okay.
Then moving to the final stage, I ask the person to, as the memory fades, I ask, "Is there anything else you'd like to do?" I keep asking that question until the person goes, "Actually, I'm happy with how the scenarios has been rescripted." I then ask them to let the memory fade and then put themselves back into the mind and body of their child self. And then 2 variations. You could then ask the child self to walk through the scenario with the adult self entering, or for brevity, I tend to ask the child self, having seen the intervention, having seen your adult self enter the scene and and say what they've done to the adult self and what they've said to your younger self, how do you feel now? And invariably, if it's done correctly, the feedback is, I feel much better. I realise I wasn't to blame. I feel much safer now. It's great getting that hug, and I feel safer, happier, better about myself. Yeah. And then the final question is there anything else you'd like to see done? Mm-hmm. And often not, it's another hug. And and then once that's complete, I get the person to put themselves back, ground themselves back into the therapy room, into their adult selves, some slow breathing, then open their eyes.
Yeah. So you can see how it's quite an apt name, imagery rescripting, because you're targeting the imagery first and then you're allowing them to rescript it themselves and change the way it is so that it can have, I guess, a bit of a different impact or less of an impact on them later.
Absolutely, and I think it's and I've seen some extraordinary change if you get the right memory and if there's only one or two key memories that's impacted on the core beliefs. I've seen some quite extraordinary shifts in a relatively short period of time. I usually like the clients to come back about 2 weeks later, and I ask them, how did you find the exercise? How is the memory now? And if they say things like, actually, it seems to have faded, it seems to bother me less, I can totally understand how actually I was a blameless child. If they use that type of language spontaneously, then that gives me the message that actually the rescripting's done its job. And then I suppose the reason why we do that is we want the client to experience a change in their current day-to-day life, so the way they feel about themselves, other people, and how they interact. And if the patient starts saying things like, actually, yeah, I'm feeling much calmer, actually I'm feeling better able to go out, or my mood's improved, or there was this one person, she engaged in people pleasing. She didn't feel that she was good enough, a critical parent. We engaged in imagery rescripting, her self-esteem improved, and it actually inadvertently raised issues within her family environment, because the bullying older sister would ask, give me your credit card, I'm short of money. And as a people pleaser and with low self-esteem, she would give her sister her credit card, she would max it out. And then after the rescripting, she started to say no to her sister. So, which was great. She felt more empowered, better able to say no. But as you can imagine, we need to spend a period of time with the client to help renegotiate her relationships with those people around her that actually we're used to the people-pleasing version of herself. So that's but yeah, in a way, cognitive approaches can get to the same outcome, but with the correct memory, the experiential approaches, from my experience, can get to the same outcome, but much more quickly.
Okay. And you mentioned earlier that when you're identifying the memories based on the core beliefs, sometimes you'd find things that seem like they could be quite innocuous. Could you give a couple of examples of memories that you've come across that you might bypass and just think that it's not a big deal, but for that person it really is?
Well, a perfect example is I was working with this one woman who experienced sexual assault when she was 13 years old. And as a psychologist, anyone would have assumed that the traumatic memory would have been this sexual assault. And so she came in, she felt the situation that raised a lot of emotion for her was her experience at a party, a social gathering. And I asked her the questions, how did you feel? I felt rejected, I felt vulnerable. Does that have any associations for you when you were younger? And it went back to the situation regarding the sexual abuse. And she said, well, the abuse itself was pretty nasty, pretty ordinary, but she said the thing that really stuck in my mind was the next day at school. Rumours had spread, and rather than the story being she was assaulted, the story was that she had willingly slept with this person. So the memory was when she went to school, saw her friends, and then she was rejected by her friends, and that was the memory that really stuck in her mind. The sense of feeling rejection, feeling confused, what did I do wrong? Was I at fault at this? And so that was the memory that we rescripted. And that was the work that brought about the biggest shift for her.
Are there also any indications that you might have for, rather than using one of these experiential approaches, using a CBT approach, so that's cognitive behavioural, such as, say, building up an alternative core belief, where you might, over time, get them to use a thoughts diary and put down more and more reasons for this alternative core belief to try to grow it up in opposition with that negative one?
With virtually all clients, I would start with a CBT approach. I think it's I would very, very rarely move to to the experiential technique early in therapy. So building that relationship, undertaking the assessment, creating the formulation. So the whole idea is how everything interconnects. Then usually behavioural interventions. If there's low mood, doing some exercise, just getting out and about, building that routine. That in some ways that's got the best evidence base regarding sort of low mood, for instance, is those behavioural interventions, and then beginning to look at the cognitions, which is the thinking, the thinking styles, and sometimes that can have great impact. Especially for so-called non-complex cases, but invariably if there's childhood experiences, then the cognitive interventions tend to work more slowly, or you get the comment that logically I understand what you're saying, but emotionally I don't feel it. And then when that type of language comes up in sessions, then for me an experiential technique is probably the best approach.
Specifically, what kind of diagnoses, disorders, problems essentially that people have had has imagery rescripting been used with?
Okay, so over the past 10-15 years there's been an extraordinary amount of research looking at applying this technique to a whole range of disorders. It started off with PTSD, which has a good impact, generalized anxiety disorder, agoraphobia, social anxiety, depression, OCD, bulimia. I've done research on applying imagery rescripting for people who hear voices. There's also research on people who have delusional beliefs. It's quite extraordinary actually, the different areas and the breadth that the research has explored, and virtually for all those areas they've come up with positive outcomes.
Okay, yeah, that's good to know.
There was a recent meta-analysis. And meta-analysis is where they gather all the research from different studies, a whole range of studies, and they found that imagery rescripting had an effect size of 0.9. So for those of you who know how to interpret effect size, 0.9 is actually extraordinarily high. So it's actually proven to be a powerful technique.
Okay guys, so that's our video on imagery rescripting. Thank you very much, Gino, for coming. For allowing me to come and interview you today, and I hope that's been helpful for you. If you like this video and you want to see more, hit the like button or hit subscribe if you want to see them in the following weeks. Thanks.